episode of NorCal News Now. We're chatting with Tami Ritter, Butte County Supervisor for District 3. I'm your host, Mike Richman. How you doing there, Aaron?
Doing good, Mike.
Good to see you.
Here
from
California.
Yeah, and I'm here in Boynton Beach, Florida. So we have our social distancing going on right now.
Yeah, doing good. It's a new way of life. I mean, I put on the tie for you because I want to keep things as normal as possible. Yeah.
No hat.
Well, I am in sweats though, Mike.
Never show what's below the fold, Aaron. It's the first secret of television.
But I did a double Windsor for you guys, and I'm very pleased. Very pleased to have double Windsor. You get a nice little. It's more professional. I try to be
very classy. Very classy.
Very happy and pleased that Tami Ritter, Butte County Supervisor, could join us here today. Kind of talk about getting down to more of a local level and in the county across this great state and great country, what's going on, and and talking about what we can do as a county to prepare ourselves, not only for COVID, but for some of the economic concerns that are going to be happening here, and some of the humanitarian concerns probably coming up. So, Tami, I wish it wasn't on these circumstances, Supervisor Ritter, but very happy you could take some time out to join us today.
I'm glad to be here, and particularly glad that you have pants on.
Yeah, I saw that joke today where it said, wear a mask and something else to the grocery store, and somebody got kicked out for being naked. Just wear the mask. Little humor to start out the conversation, but I know we're all kind of in cabin fever lockdown and not lockdown. Sorry, just stay at home. Advice from the Governor Newsom here in California. Mike, there in Florida, what are you guys? Are you guys on similar circumstances?
Yeah, there's been a lot of controversy here in Florida because, all these images of these kids frolicking in the beaches for spring break.
Yeah.
So Governor DeSantis today shut down the beaches. There is not a shelter-in-place order in place here in Florida. Of course, we have a very, very vulnerable population here. Of course, my parents are here. The reason I'm here is caregiving for my mom and dad, and I can't see them now because their facility, their community, which is an elderly care facility, is on total lockdown. So none of us can visit them. We can't physically see them. No one in their community is sick, as far as we know, but they can't have guests. So they're taking a lot of precautions to try to protect those very elderly populations.
And in California, a little bit of confusion today. Some people maybe thought they might not have to go to work today, or might be told to go home because of the governor's orders last night. But I want to get back to Tami and ask her kind of what she hears from the county administrators, and I know the governor lifted the order, the Brown Act order, so some businesses or some county and government business can still continue. A little update on that with the county.
Right. So what we're hearing on the supervisor level has to do with how we are conducting business, whether we're going to pass ordinances and the kind of things we have to do in order to protect our employees, because these are a lot of changing work conditions, and every changing work condition means a discussion or a negotiation with a bargaining unit. We can't just, as a county, say folks don't need to come to work or folks do need to come to work, right? Those kinds of details are all hammered out in our bargaining agreements with each of our different units. And so we will be having a meeting on Tuesday, and that's to pass emergency ordinances, basically, so that folks can be working at home, so that some folks can be using their home computer or can be using a county computer off-site in order to be doing the business of the county. And then, of course, there's still the jobs that are considered essential. And so those folks are going to continue to work, hopefully with a minimum of 6 feet between them and their nearest coworker. But all of those essential services have to continue to happen.
And yeah, the governor listed 17 or 19 different essential services, basically sectors. And of course, agriculture, we're a big agriculture community. Certainly a lot of different need out there still, grocery stores, gas stations, things like that. But within the county, we're looking at utility servicemen and women. We're talking all kinds of services year round. I know that the governor plans on keeping the dam, everything else, all these essential services running. But do you have any advice for other businesses or organizations, nonprofits out there for kind of where they should get their advice from, where they should get their news from, and kind of what things they need to have in place?
Yeah, there's a daily update that's posted on our Butte County Public Health page. And I think that is the most up-to-date information we're going to get, because it includes the California Department of Public Health, it includes the CDC, it includes all the information that has been accumulated in the 24 hours prior. It's posted and updated every day at noon. It tells us whether or not we have any positive cases of COVID-19. It also talks about any of the new rules or regulations that are coming down from the state level. And so I think our public health page is a really good resource. And then each Thursday, the medical director has been doing a press conference and answering the questions that folks are sending in. Particularly, there's been a big focus on testing, because there hasn't been enough testing in Butte County or anywhere else for that matter.
That's right.
The governor came out, and it was a well-known national story, I think it was just yesterday, and said that, the estimates, some of the modeling he's seeing is saying that, up to like 25 million people in the state of California could be infected with COVID-19 within the next 8 weeks. And, when you look at the modeling again from the number of people that have serious infections and the number of people that have critical infections that need the ICU and that really have serious reactions to this, Butte County is going to have its share of that. And the question really is Butte County, is the Butte County medical community ready for that in terms of the equipment they need? We're hearing this in New York and some of the larger cities that they're going to run short of ventilators, they're going to run short of masks. I mean, how is Butte County doing with those supplies?
Yeah, New York's a great example, because there was rural areas that thought that, well, we're not gonna be harmed, this isn't gonna be so bad. But actually, they were so under-equipped that patients had to be transported to larger municipalities for care, and overwhelming the larger municipalities hospitals. So, and would like to get Supervisor Ritter's opinion on this, but I have sort of an underlying fear, because of not only the poor air quality that has been up here from certain things, but the fires that have come through here, and some of the respiratory issues that people have carried from that, and then not having adequate enough infrastructure and services and equipment, and testing for one, but the equipment after it does happen. So in talking with David Welch last episode, it seemed like, putting the need out there, definitely, but there hasn't been much resolve on that issue from the federal government. And now you have 51 state governments with salespeople over in China trying to find masks to bring back to the United States. So a little bit of disorganization between those government agencies, but getting it back down to a local level, I'd like to, get Supervisor Ritter's thoughts on that, and making sure what are we prepared for on the county level?
I think like everywhere else, we definitely have a problem with supplies. Our social service workers are told to reuse their masks. And so the information we're given from day to day changes based on what supplies are available to us. With our Department of Employment and Social Services, there's just been money made available for housing some of our most critically at risk people who are already living on the streets, maybe are homeless from the Camp Fire or other disasters. And the way in which those resources are going to come to the county is very unclear. There was word from the state that they were going to be providing us with hand sanitizer and masks and all kinds of stuff to, help slow the spread. But that's not a typical function of the county. And so we have to be coordinating with those nonprofit agencies that you mentioned and some of the other entities to look at how we're going to get supplies into the community when we have them. Right now, we're going against CDC guidelines and we're reusing masks, and people are keeping latex gloves on their hands because what they're finding is that they're less likely to touch their face if they have gloves on their hands. But it doesn't mean that they're not infected. So I think that the best thing we can do, like everywhere across the globe right now, is that we can work on slowing the spread. And what that means is staying home. It means not thinking that this is overblown or this is hysteria. If Butte County should escape, this pandemic and not be infected to the level that we're seeing a lot of other places, great. It's not for nothing, right? We're staying home, not just for ourselves, but for those healthcare workers who are providing essential functions in the hospitals right now, in the care homes, in the senior living facilities. Those folks have to go to work. And so the less of us that get sick because we're staying home, that's less people going to the ER. That's less people needing resources. So I think it's really at this point as much about prevention.
Right, and you see a place like Nevada County that has very, very high rate of elderly seniors, people over 65 years old, and making sure that they were taking measures right away. Just thinking about the home healthcare workers and the industry there, and how much basically what the doctors are saying, well, if you have symptoms, go home, and we want you to go home, and it all sort of leading back to elderly people and with them trying to care for them at home. In the next 3 weeks, would we be ahead of the curve if we started training home healthcare workers on ventilation machine trainings?
I don't know that we have the ventilators.
Right.
So, what we've heard is we don't have enough ICU beds, that we don't have enough supplies. And so I think we need to be leaving the medical care to the trained medical professionals. And I think that we need our home healthcare workers and those that are caring for others to be taking the precautions that we're hearing are so necessary.
Yeah, so they don't add to this tsunami of cases that we fear are coming. Do we have a sense for, and again, this is all projection, it's all modeling, so hopefully we won't hit any of these numbers that many fear, but if we do reach some of the numbers that the governor is talking about, where do the beds come from? I mean, is there planning now in place to look at, hotels, to look at other facilities, tents,
college campuses?
Yeah, or in the campus, sure. I mean, anything. We're going to need places to put people if they need this care, and there just won't be enough beds in the hospitals around Butte County. So are there contingency plans now being formulated for that?
Our Office of Emergency Services is definitely looking at that. I mean, we've seen that across the state where, Aaron, like you mentioned, folks are going to be using colleges. And previously there was there was a directive by Chico State that students, though their classes were going to be offered online, should be, returning to the dorms. That obviously has changed, and so that will, free up some areas. But, folks didn't move out of their dormitories, right? They were not aware that COVID was going to happen, and so it's not like the summertime when we just have empty dormitories, right? And so the use of hotel rooms right now is what's being proposed for individuals who are without homes. And then even then, the county is having to use calculations to determine who are the most at risk, right, in that particular population. So are there elderly or folks with medical needs that are currently unhoused that are more vulnerable than others? Because ultimately that's what the care, we've seen this in other countries, what the care comes down to is who has the best chance. And it's a horrible thought to think in a Western, supposedly developed nation that we would ever get to that thought. But if we're limited on ventilators, I don't know how the medical professionals make those determinations. And that is certainly not a county function. We, as the county, administer services. So behavioral health, employment and social services, but we don't do medical.
Are there resources that are still in the county from FEMA, still kind of left over, for lack of a better term, from the campfire?
There's housing units that are still here, okay. And certainly, if this doesn't count as a disaster, I don't know what would. But one of the issues is that as we rely on our community partners and nonprofits, the county works with the state government, with Cal OES, and with FEMA when we're in disasters, and we work on a reimbursement, right? So we administer services, and then we file with the state or with the federal government for reimbursement. And so as we bring community partners in, they would be looking at that process as well. And it's not necessarily something that every nonprofit is equipped to do or has the internal capacity to do.
Yeah, and I think we talked about it a little bit before, but is it this government agency's job? Is it that government agency's job? And the philosophy of, is it the government's job to order masks, or is it the state's, or is it the White House administration's job? So getting back to that, I think you still have to be prepared on the local level, on the county level, to do what you can, knowing that state and federal government might not be available to lend itself.
Yeah, I agree on all levels, right? Is it the state? Is it the federal? Is it the county? Yes. It is all of those. And if we had robust plans in place, if we were expecting this, right, as perhaps we should have been when we started to hear about it weeks ago in China, maybe we would be in a better position right now. But in terms of whose job is it, I think that probably what you'll see is every single government agency pointing the finger at the other one, saying, no, this is your job, this is your job. Ultimately, the way that government works is that for each jurisdiction, they are the ones that are in charge, right? So if the city of Chico finds that they are unable to take care of their residents, they're going to turn to the county and they're going to say, we can't do it, right? Or the city of Orville, and they're going to say, we can't do it. And then it becomes the county declaring a disaster or an emergency, and then the county taking basically responsibility for that.
I've seen other communities across the country already start to prepare towns, everyday American towns. Chico is a college community with a rural outlaying. A lot of those the service industry here, it feeds the outside communities, and in turn, the agriculture feeds the cities. But you have a lot of people out of work, and something that doesn't come with a layoff is the continued health care that you were either paying for or getting through work. And then you have the even more vulnerable people who are without a home or have circumstances on the living on the streets or with little means. I've seen restaurants already being prepared as humanitarian kitchens, community kitchens, to be able to serve in time of need. Is that something we should be starting to prepare for as a county, and looking at not only the emergency health factor, but the economic disaster that's coming forward?
Yeah, I'll go back to something that we were talking about a little bit earlier about, how much overreach can a government have? And, just like we have our own personal property rights, I can't, and the county can't go to a restaurant and say, you will no longer, prepare your meals and be serving them for takeout. We're going to take over and we're going to turn this into, a kitchen for folks that don't have enough food. Where we're seeing those kind of humanitarian projects pop up, that's because the restaurant owner decided that that's what they wanted to do, right? Mm. If the economics is the piece that we are most concerned about with that, then I say we allow those restaurants to continue operating and doing meals only for takeout. They seem to have a pretty good system that they've worked out, most of the ones that I've seen locally. There's no more dining in. But that is one way for them to continue to keep their business alive during this, in terms of, folks not having health care or even not being able to pay their rent and things of that nature. That's something that's being looked at every level with the county. There was automatic 80 hours of your sick time that you could access. We're seeing all kinds of protections in place for no evictions during this. We're seeing things from the insurance commissioner about if people can't pay their insurance premiums, that they can't be canceled. So I think that those economic impacts are certainly being looked at where they can be. But in terms of what the government can enforce or require of folks, with whether it's with their local business or their restaurant or what have you, I think that that's where we get into a little bit of a dicier area, because essentially the governor's order is a directive. It's telling us stay home, right? It's not saying you now have to turn your money-making business into a not-for-profit where you give your product away.
Yeah. Okay.
Supervisor, it's pretty well known. I mean, and just to change gears here just a little bit and talk politics, if I could, for just a moment. It's not unknown, I think, to any of us watching the show or certainly talking here today that, it's been a very divisive period of time in American history on local level to national politics. And every challenge that humankind faces contains the seeds of opportunities. And I think that there's a way of looking at this optimistically that says maybe something like this that's so disruptive, that changes everything, all preconceived notions, and kind of forces us to have to work together, could in the long run be a good thing, maybe in terms of healing some of those divides. Do you think that's a fair statement? Is it okay to look at that optimistically, do you think? Right?
I think that's a beautiful way to look at it. And I would say Butte County has been given a plethora of opportunity that we haven't seized yet, right? We had the disaster with the dam, was unprecedented to have that many evacuations. And then, we are not even into the healing and recovery phase from the Camp Fire. We still have so many people who are living in conditions that are deplorable. We didn't seize the opportunity with the Camp Fire as much as I would love to think that what you're saying is true, I now have, a year and 3 months under my belt, working for this county and working with this board. And I wish I could believe that. I wish that I could believe that a disaster of the Camp Fire's magnitude, a pandemic, would be enough to encourage, this board to work together. Sadly, I don't see it happening. There has never been a time in Butte County's history that we were ever in need of housing as much as post-Camp Fire, right? And no matter how hard I tried, I could not get 3 votes to allow for tiny houses and to allow for yurts and to allow for, folks to be living in more kind of campus oriented, where we could waive the requirement that every home have a bathroom and a kitchen. There was never a better time for that to happen than post-Camp Fire. And here we are now talking about, what are we going to do? Are we going to put people in tents? So as much as I would love to believe that folks would be willing to work together, if it didn't happen after the Camp Fire, I'm not optimistic it's going to happen from this.
Yeah, that's a fair comment. It's a sad comment, but I think it's a fair comment.
The Chinese symbol for crisis is also the symbol for opportunity.
Mm-hmm.
And I have some reservations like Supervisor Ritter on that, but I think looking for a silver lining, I think going forward, and it will highlight the need for more things done on the issue of housing, and certainly vulnerable people in our society. Healthcare is another thing that I think is forever going to look different to the American people. And even how the disaster started with what we eat and how certain things we do in civilization, and how a lot of these where a lot of these things are coming from, and kind of changing the way some of those structures and protocols, so that things like this don't start up and fever up again. But I'm hoping that there's some silver linings, and one of the things is some of the great people that we have in our community that work in the grocery stores, that work on the front lines of nursing, or even in the in the elderly care units, or anywhere, and being able to highlight some of these other groups, and just remembering and not taking for granted the need that they serve, and understanding going forward that they certainly deserve a good paying wage, and certain benefits to protect them and their families.
Absolutely. And that brings, to mind that some of our folks who are most vulnerable are the folks who are caretaking for our elderly, right? And they're going into different homes, and the vast majority of our home healthcare workers, they don't have health insurance. So if they get sick from this, what protections did they have in place?
How does that make sense? That they face the tab for something that of no fault of their own, and they're trying to protect. It's terrible. It reminds me of the firefighters not getting benefits after 9/11. It just makes absolutely no sense. My grandfather was a grocer before he got his farm and started farming in the Midwest, and absolutely loved it. He was, loved the profession, loved talking to the community. Everybody knew him. He always wanted to have a conversation, and really, he always, thought very highly of that profession, and understood it as a really nice community, thing. The grocer. So I'm just remembering some of those facts. But to get back to politics, Mike, and I don't want to, but the president was asked the question today by a reporter, what do you tell to American people out there that are scared right now? And so I guess I'll ask Supervisor Ritter, what do you tell people in your community that are a little worried right now? And does that question completely offend you, or is that sort of a normal question to ask?
So, right, all politics are local. And I honestly, I believe that's where the change is going to happen, right? What we do have control of right now is what we do, right? So if we can keep ourselves in our own isolated little bubbles, while we work on increasing our capacity at medical facilities, while we work on, they're finding some antiviral drugs that are they're seeing are somewhat effective for COVID-19. If we can slow this down, and we can do it by assisting with, if we have I have a whole block of folks, we have we live on a cul-de-sac, and we have each other's information and emergency contacts, and if there's any medical needs, and so that folks don't have to reach beyond their immediate community. That's what we can do right now. It's scary, it's uncertain, but the more time that passes that each one of us does not get infected, the better off the entire community is going to be. Because, as David was talking about on your last show, we're going to lower that curve.
Flattening the curve.
Stretching that out is what's going to allow us as a community to be able to weather this storm and to really be able to heal afterwards. Because I feel like we are not even done healing from the campfire. And then we have this kind of layered on top of it, and think about our social service workers who are out there and who are doing this and are considered essential. Those folks, they need for us to stay home, to not infect anyone else, right? And to do what we can do. That's the way we can be supportive. And so, I don't think there's any magic solution. I think that's what people would like. But the reality is that we have the power that we have is to keep this infection from spreading. And yep, it might be boring and you might be getting a little cabin fever. But you know what? It's a great time to do that gardening project you've always talked about, or to, paint your garage. I don't know, do something.
Parks are open. Get out the old book. And I tell you, it's not much different from, I'm pretty recluse.
Been training for this your whole life.
Sadly, there is some guilt now. There's a little bit of regret now, of course, but wanting to have a little bit of social interaction or go to the local pub. But getting back to a little bit on the federal side, and understanding that the grocery stores are going to be filled back up Monday. There's the trucks are coming out. Try to relax a little bit. That process, that infrastructure is still working, still running. It's just that they got bought out a little bit. But there's deliveries coming, and so if your grocer isn't filled up, he's going to be filled up soon. So no worry there. But Mike, getting back to the economics a little bit, Tami and I both listened to Representative Doug LaMalfa, Congressman Doug LaMalfa here's town hall, and understanding where the Republicans were coming at from this economic stimulus that are basically going to a lot of the people that have been affected recently that are on the lower pay scales, and unexpectedly, just like that, losing their job and being able to have to face no income and filing for unemployment benefits if they're lucky to be able to qualify. So LaMalfa kind of talked through, and I couldn't really understand it, but it was almost this Republican argument of somehow higher earners should get a little piece, and the people that are on the lowest of the low earners and actually don't even make enough money to qualify to get taxes should somehow earn way less. And it didn't seem, from a Treasury standpoint, it said that was going to actually take longer, and to do it that way and worry of not getting these checks in people to the time to actually help the economy, that cutting off these low-income people of an extra $600, which is a drop in the bucket to government for what they're doing for the corporations. But talking with you, why the Republican plan moved forward the way it did, and why no Democrats were even allowed to, put in proposals till today.
I can't, I cannot justify, LaMalfa's position. To me, listening to the town hall, it sounded like he was justifying trickle-down economics, which we have already seen doesn't trickle down and doesn't get where it needs to go. We have seen our government make decisions about, bailing out Wall Street and millions of dollars that are going to, the richest of the rich, while we, fight for scraps for social services and for food stamps. And so, yeah, I'm not gonna be able to shine a light on how this could possibly benefit us.
It seemed like it seemed like he wanted to talk about COVID. He wanted to talk about COVID, but it so quickly the town hall went into immigration and the Shasta Dam and some other things that are on a list somewhere. It didn't seem like there was an awareness of the critical economic need that people in the community are going to be facing. The Republicans want, one payment of $1,200 to families. About $55,000 is the median income for Chico, I believe.
It's lower than that.
Lower than that.
Yeah, I think it's 43.
And I know Oroville and Chico are close, but I know Oroville has about a 50% of the 50% of the population is paying more than 50% for their mortgage or their rent, and relying on that job. There was some relief today, it looks like, for homeowners to have some mortgage payments deferred or put on the back end. But absolutely no rent or no relief so far, and I haven't even heard anything talked about for renters, and except for the no evictions.
Right.
But I haven't heard of any economic relief. So I can't imagine I sort of can, because I think my stepson's in a similar situation, but possibly being laid off from your job that's paying you to go to school, being told all your classes are going to be online now, and having no money to pay your rent. Seems like a very bad situation for some people in that circumstance.
Yeah, and I think it's a very what is being offered is very similar. So it's not that that homeowners are the payments aren't being waived. It's not like there's a payment that's being made to the mortgage company on behalf of the homeowner.
Oh no, yeah.
It is simply you're adding it to the back, right, of your mortgage, and so it's going to continue to accrue interest. You're simply not going to get a missed payment for it. And I think that the eviction protections are essentially the same thing. It's not saying that someone doesn't have to pay their rent. It's simply saying they're not going to be evicted for not paying their rent, right? They're still going to owe their landlord, by the time this crisis is over, 2 months, 3 months, whatever it is, back rent, but that's not a reason for eviction right now.
Yeah, and understanding some of those outlets and going through some of those things, but and bring you into the conversation a little bit too, Mike, on just sort of the anxiety maybe you've faced in the last few days. I think you've been kind of on a little bit of a secluded lockdown more than us. I know the weather's kind of been nice down in Florida, but especially with your parents, I know you want to, try to avoid contact as much as people with anybody. Really,
I had to get them supplies today, but that was the only time I've been out of the house in 5 days, literally out of the house. And there's not a lot of people around down here. There's just not. I mean, people are. Again, I think the image of people at the beaches is kind of a misnomer because the state is taking it fairly seriously. It's hard to know because obviously you're only in one place at a time. But from the images I've seen, it seems like this part of Florida, at least, is certainly taking it fairly seriously. Many of us know elderly people, have elderly family members, and we're trying to protect them. Certainly the people that are running retirement communities are being extremely serious. I mean, like I say, I was able to deliver some supplies to my parents today, but I had to go through an interview process at the front gate. I had to have my temperature taken. It was 97.9, by the way, so I'm good. And then I had to go to the front desk and just drop the supplies off. I couldn't see them. I haven't seen them now for more than a week, and it's hard. I mean, they're elderly. They have a lot of pre-existing conditions. They've canceled all their doctor's appointments. My dad has a very bad cracked molar that he needs to get taken care of, but now's not the time you want to have oral surgery, of all things. So,
yeah,
we're just hunkering down and hoping it doesn't last very long. I guess like all of us, right?
I think we all want to see the curve flatten. I think once we see the curve start to, taper off and flatten out, I think maybe there'll be a little bit of shoulders at ease, but understanding we still have a long way to go and a lot of unknowns going forward from there. But what's something you've been doing to kind of relieve maybe any pressure, anxiety, stress while you're cooped up, or just to pass the time?
For me, I've been working. I mean, I'm able to work. I've been working from home for about a year and a half now. So I just am doing the same thing that I've always been doing, working with my clients and writing and doing marketing and sales work. Fortunately, knock on wood, that so far my clients are financially keeping it together. So that's good. But one thing I've been doing is I've been watching a lot of politics. I've been watching a lot of CNN, and
I was going to ask if you're staying away or you're watching. We have to know what's
junkies. I wanted to actually circle this back to a question for Tami, because I know you and I talked about this last week with David. But I've continued to think about this, and it really kind of talks about the issues we're talking about now. This idea that this unfolding disaster really is exposing a lot of the schisms in American society especially between the rich and the poor. And it is surprising to me that what Bernie Sanders was saying in that debate a few weeks back hasn't had more bite, hasn't really seemed to penetrate the consciousness, probably because people are just so focused now on their own personal issues with this. But it does seem like his message is one that you would think would catch fire a little bit more. And Tami, just to bring you in on it, do you find that a little surprising that what Senator Sanders is saying in this campaign hasn't hit more traction?
Again, I at risk of being, really a pessimist here. No, I don't. It doesn't surprise me. And here's why. The retelling of history is told by the victors, right? Like we sit in a place of privilege if we have health benefits. We sit in a place of privilege if we are employed. If this disaster has not, taken away our livelihood, and so. As I see over and over again, it is not the voices of the people who are in need, and it is not the voices of the people who are suffering that we're going to hear. It's going to be the politicians. It's going to be the people sitting on the dais. It's going to be the people who have some measure of privilege and that are doing okay. And so that's why I don't think that this is going to be our wake-up call, at least not during this disaster. You know, we learned, you know, with the campfire, how vulnerable all of us were in very different ways and in many different ways. And we haven't had time since then to rebuild our infrastructure, to rebuild our systems, and to take care of people in the way that I feel like we should. And so, you know, I think that, Aaron, to answer your question, it's going to highlight that, it's going to highlight that difference. But no, Mike, I don't think it's going to, I don't think that we're going to see, you know, healthcare for those who can't afford it as the primary issue that we all focus on. You know, because right now, you know, we're seeing that when the LA Lakers are exposed to COVID-19, there is suddenly enough tests for every single one of them to get tested immediately, right? But not for the emergency room nurse and not for the emergency room medical assistant who is mopping up the floor or the person who's checking them in at the hospital. And so why is it that we can have tests for people who are of means, but we don't have tests for folks who are exposed repeatedly?
Yeah, a question I had was about the school system there in Northern California. You know, for many kids, you know, many parents look at, you really have schools are kind of daycare. In many cases, it's a way for the kids to get a good meal. And I mean, there's a lot that goes into school beyond just the schooling, which can be somewhat replicated online. If parents can't be there with their kids, at home. I mean, certainly they're supposed to shelter in place too, but if parents have to go out and work, let's say they are a healthcare worker or they're a grocer or whatever, what do we do with these kids that have to be home? How do these kids get taken care of and get fed and all the things that we have to do?
And we have a fantastic school district. We have, you know, Chico Unified is fantastic, Butte County Office of Education, and they are, and immediately responded to that question of what if this is the kids' only meals those days, and what if the parent is still working? And so there are systems that they immediately put into operation with BCOE for childcare and for meals and a lot of meal delivery. And so, you know, I think with communities that have a little bit more in the coffers, then that happens. But the more rural and the higher the poverty level, I think the harder it is for them to facilitate dropping off meals at, you know, in these, you know, I think about the districts where, you know, the kids have to ride a half an hour, 40 minutes to get to school, and how do we, you know, how do we address those?
A lot of issues.
Well, Mike, we're lucky to have Tami on. Supervisor Ritter is, I don't know, I'll let you say it. I say she's got a master's degree in psychology or something, but I'll let you, PhD,
No PhD.
Okay, well,
I have a master's in developmental psychology and then another master's in restorative justice, youth counseling.
Mm-hmm.
Very needed at this time, I imagine.
Yeah.
I'm not sure what all that entails, but sort of my question for Mike earlier about anxiety and kind of what he was doing to pass the time was sort of a lead up to ask you what that background and what some of your advice is for either families or people at home, or people like Mike who are taking care of families, or people like me that are, you know, I don't have small children anymore, but I'm trying to keep teenagers from, you know, aimlessly rolling around town and get them to understand how important it is. But just also some of the general anxiety people are having, and especially how to us as animals, how to kind of distract the children and help with some of the problems that may be coming in the home.
Yeah, I think one of the most important things right now, I mean, we've known for a long time that one of the things that really greatly impacts our kids is them not being outside enough. And so even though we are, restricted, to our homes, I don't think that means that we don't go outside and we don't get fresh air. My yard's never looked better, right? I'm doing some serious exploitation and child labor in the weeding department right now. But there are lots of other resources like audible.com just released, a couple hundred titles that you can listen to for free, and everything from young kids that are in, preschool, up to adults. They have all the classics. You want to learn Spanish? Now's the time, right? You can, I think that's in the teen section, but everything that you could ever possibly have wanted to learn, you could probably get it free on Audible right now. So we're doing a lot of gardening. We're doing a lot of, videos and a lot of listening to books. And I think that, it's, somebody had mentioned to me that, even though we're in a crisis situation, that our kids' memories of this time can be different, right? Our kids can remember this as, oh, remember that time we stayed home for weeks and we planted
family time,
and we, whatever. And we got to watch videos, late at night. And so I'm trying to balance it at my house, with, I don't want this to be another potential for trauma. Let's, right now we have everything we need. We're trying to reach out to those in our community that might need things. And if you're in a position to help, it doesn't even necessarily mean leaving your house. You can order groceries from Costco and have it delivered to your neighbor or to a care home or to someone in need. So, I mean, I think the social distancing is maybe a little bit of a misnomer. I think what we need is we need physical distance, and we need to keep those social connections, whether it's on Skype, whether it's talking to people and friends we haven't talked to, but making sure that we're continuing those connections, right? Because that is what's going to be most important.
It's important to keep the same schedule, especially for the kids. Maybe try to keep them on that school schedule a little bit. Or are we sleeping? Are we staying up late now? Or
we're staying up late. We are, yeah.
Oh, they got an excuse to stay up late every night.
Yeah.
Yeah. Well,
so I don't know. I imagine for some folks and folks who homeschool, maybe they are, and power to them, and kudos.
Give them whiskey. I mean,
yeah. So I feel like we're gonna get a lot of good education in gardening and what's a weed and what isn't, and plant identification and.
All right. Yeah. All right. Well, Mike, I'm not sure where we're at on time right now. It's certainly been an engaging conversation with you guys. I guess I'll let you see if you can wrap anything up if you have any more questions.
Well, I just wanted to tell Tami that we really appreciate her joining us on the show, because it's a pleasure to have a chance to talk with an engaging guest who also is of course a high-ranking county official, supervisor. So Tami, thanks for joining us and giving us some perspective, a little reality check, and some assurances too. So I think that was really appreciated by the viewers. So thanks for doing that today.
Yeah, well, thanks for having me. I really appreciate it, and I appreciate being able to speak with you gentlemen remotely. It's met some of my social needs for the day. So thanks.
Us too.
We're lucky enough to have you on the show before, and the show might be taking a little break. See kind of how things roll out, but obviously Mike has his social media feed. I have mine. Tami's on hers. We can all be reached and take any questions. And Mike, 2 years of doing this, it's went by fast, man. 2.5, 3, I don't know. Had a lot of guests, have had a lot of really interesting time, and appreciate you being a great leader and champion in this, and making sure that you were always keeping us all on track. And great job managing the show for a few years. And a big thank to Chris Smith in the back that makes all this happen.
Well, we'll see what happens. Hopefully we can do some more. I mean, it's always fun for us to do it, but there's realities as well. So we will see. But again, Tami, thank you for joining us today. We'll have you back as we go down the line, hopefully. And of course, I'd like to also thank our sponsor, the North State Labor Federation, AFL-CIO, which promotes social justice for working people in our community. To learn more, visit online at northstatelabor.org. Thanks to you all for listening in, and we'll hopefully be back at you soon with another episode of NorCal News Now.